Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hi, Jess. Thanks for having me on.
So it is respiratory season, so I think we should talk about RSV. The clock is ticking, so let's get to it. Dina, what is RSV?
I hate RSV season. It's my least favorite season. I get depression during RSV season, and it's because it's one of the number one reasons we hospitalize kids. In fact, 2 out of 3 of every 100 infants with RSV infection may require a hospital stay. I feel like I'm hospitalizing kids like every other day for this. And it's a respiratory syncytial virus, which is common, and it's a cause of bronchiolitis. So we're seeing this all over the news right now. And kids will get it at least once or multiple times under 2 years old because you can't really develop lifelong immunity to it. And it causes an infection in the smallest airways in the lungs.
And it is spreading like wildfire right now. If you look at rates of RSV, especially even compared to COVID or flu, they're really, really climbing right now. So let's talk about, how do you get RSV?
We're in the thick of it right now, for sure. So it's spread like any other respiratory virus by entering from the nose or eyes or being in contact with someone who is sick with RSV and being exposed to infected saliva or nasal discharge. So we a lot of times we'll see it starting up in the fall and go through the winter, and often even see cases in the spring. So right now we're seeing a lot of RSV. So don't send your kids to school if they're sick because it spreads like wildfire.
That's just a good rule of thumb, right? I know we can't always keep our kids home, but if they're sick, just please keep them home. But all right, so what are the signs and symptoms of RSV?
So the symptoms start about 2 to 5 days after contact with the virus. And many babies and kids who get RSV act like they have just a regular old cold, so no big deal at all. But other babies, however, will have trouble breathing and need to be hospitalized. So the common symptoms, like any respiratory illness right now, are cough, runny nose, congestion, fever. But other times babies, especially small babies, can breathe fast, they can wheeze, they can have trouble breathing, and they can have what's called retractions, where they're sucking in the muscles on their chest, which is a dangerous sign. And about 30% of children with bronchiolitis will actually even go on to develop asthma.
So what you're saying, and correct me if I'm mistaken, so for the majority of kids, it should be mild, but it can be severe, and that's especially for the youngest kids, right? So young infants.
Correct.
All right. So how do you treat RSV?
Unfortunately, I wish I had a magic bullet for RSV, and I guess that's what makes it so frustrating for us. So the treatment is basically done just ease symptoms and involves mostly rest, staying home, hydration, because kids, when they're breathing fast and congestion, might not want to drink, and fever control with Tylenol and Motrin if age appropriate. So a lot of times also in the office, we'll try to use a normal saline neb on babies to see if that helps, like soothe the airway and the breathing. And occasionally we'll try something like a bronchodilator, like albuterol, which sometimes works, sometimes doesn't work, but when we have a kid in front of us wheezing, we will try everything to avoid hospitalization. And if it's severe, sometimes it requires hospitalization, and some of these babies will require oxygen.
So as Benjamin Franklin once said, an ounce of prevention is worth a pound of cure. Are there any ways to prevent RSV?
Yeah, so we were so excited about these new vaccines that came out, and then we realized that they're not available widely to all people. So there's this new vaccine for pregnant moms that can be taken in their 3rd trimester. We highly recommend taking it because it protects your baby. But there's also this RSV preventative antibody named Beyfortus, which is a shot that prevents severe RSV disease in infants and young children. And it provides antibodies that protect babies right away and last for the duration of the typical RSV season. So right now, what we're doing, because it's hard to get, if the mom has gotten the vaccine, we're not giving it to the baby. But if the mom hasn't gotten the vaccine, we strongly recommend giving it to your baby. AAP recommends a single dose of it. 1 dose of it is recommended to be given during or right before the RSV season to all babies younger than 8 months of age. And 1 dose is recommended to be given to some children age 8 to 19 months who are entering their 2nd RSV season and are at higher risk for serious disease. So hopefully we'll get our act together and this will become available for everyone. We'll see a decrease in rates of RSV and hospitalization.
Yeah, it must be so frustrating. I'm sure there are people listening to this right now who are like, oh, I want it for my kids, but it's just not available. But we, and I don't mean Dina and I, but we collectively are working on ways to make it more accessible. All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.